Hello, my name is Katie Weber with the Indiana Complex Care Coordination Collaborative at Indiana University School of Medicine. I am here to ask you to consider how to better support the mental health of your patients with intellectual or developmental disabilities, or IDD. Patients with IDD have higher rates of mental illness than those without disabilities. However, they often have difficulty getting equitable and effective mental health services. Diagnosis and treatment can take finesse and accommodation. Most persons with IDD can read, but their reading level is more likely to be in the range of 2nd to 4th grade level. If they are going to answer screening tools, they need easy read options. The typical PHQ-9 and GAD-7 for mental illnesses do not work well with this population. They may respond better to existing adapted evaluations. There are adapted but not validated versions of the PHQ-9 and GAD-7 with pictures and simplified questions. Another set of tools is the Glasgow Depression and Anxiety Scales for persons with IDD and their caregivers, which are validated and somewhat longer. You may not be able to get clear answers from standard screening tests. A clinical interview with supplementary information is recommended as the most reliable approach to the diagnosis in persons with IDD. For those patients with IDD who may not be able to provide effective verbal communication, you may need to collect information from others who directly observe their behavior. The National Task Group has created a behavior change form called the NTG-EDSD for early detection and screening of dementia. This form can also be useful in describing current adaptive function and recent or long-standing functional changes that can be seen in mental illness. The majority of persons with IDD have Medicaid coverage. Statewide community mental health centers are a significant resource in finding mental health clinicians. Some agencies have teams who specialize in services for adults with IDD. The Psychology Today website, psychologytoday.com, has filters that you can apply to match patients with a mental health professional who has a special interest in working with persons with autism or intellectual disability. Behavior consultants, or behavior analysts, are unique mental health professionals who can be of significant help when caring for persons with IDD with behavioral problems. In general, Medicaid waiver plans are the easiest way to access these services. Behaviorists perform functional behavior analyses or observations to seek triggers for challenging behaviors. They create an individualized behavior management plan for the circumstance of concern. They provide ongoing therapy sessions to help engage the person and caregivers in enacting the plan. Thank you for watching. You can find links to the referenced documents at forourhealth.org. To assist your patients in learning how to work well with mental health services, you can refer them to the partner video at forourhealth.org.